I'm really proud. Our state's done great work on suicide prevention, but sadly, after the pandemic, we've seen the numbers go up. The CDC just released a report 2 weeks ago that shows our whole nation is experiencing increased rates of suicide. The highest increase was for American Indian, Alaska Native populations that went up 36% for youth. We also see a huge increase of Black youth and the number of veterans. And so this is probably the work we're doing around behavioral health in 988 is more important than ever. And so the bill before you, again, is really trying to make sure for when people call the 988, I think about 95% of the calls are, the intervention ends with the phone call, but about 5% needed outreach. And it's really important for people to feel safe and to call that it be a clinical response. So we're looking at clinical teams, that's behavioral health, someone with lived experience. Some teams in some part of the state will include EMS and fire, and who wouldn't want to work with a firefighter? So we're really excited about that. So we're trying to imagine these teams, and part of the bill is really trying to put incentives that we can enhance and create these teams so they can respond, like in urban areas within 30 minutes. Because if we don't do a rapid response, it will be law enforcement, and we think in many cases it really needs to be clinicians. We also have training in the bill, which is really important. It needs to be regional so people know how to work together. It needs to be around cultural sensitivity, intellectual developmental disabilities, working with veterans, and agriculture. So we understand and we have well-trained staff to do this. The other two components is liability protection for people doing the work, and then finally really promoting 988. And again, I think as we move forward, this work is going to save lives, and urge your support.